Hello, everyone, and welcome to the final session of Nursing on the Front Lines of the Climate Crisis, Strategies for Advocacy and Action. I'm so happy to be with you all today here with our panel for session 10. This is our final session in this series, and it is a very special session. It is an interprofessional session for strategic engagement, a little bit different than some of our other sessions, and going to welcome our speakers in just a moment. So thanks for everyone for being here. We will go to the next slide. All right. We are happy to offer closed captioning for this course. There is a link at the bottom of your screen that is entitled closed captioning. Please click that link, and Spanish captioning is also available. This is session 10, Interprofessional Strategic Engagement, and these are our course partners and supporters. We are grateful to them for their support throughout the course, and we are going to all here today to increase our knowledge and our self-efficacy and to improve our communication and to develop improved strategies for advocacy and action related to the climate crisis. Individual attendance will be automatically recorded during this session, and it is not counted if you join with a colleague's link. The video recordings are also available through the Alliance of Nurses for Healthy Environments. If this is your first time going to our learning platform, please see the black code on the left of the screen. And if you have joined in previous sessions, you can access any of the recorded sessions on the QR code on the right-hand side of our screen, the purple QR code, or you can just go to the website at learning.envirn.org. After today's session, the final exam will be ready. It is prepared. It is a 25 multiple choice and true-false question exam. Participants must take the exam in one sitting using the same email that you signed up with when signing up for the course. The exam link will be sent out later today, and it will be available via email and also via WhatsApp. It will remain open from today through December the 16th at 11:59 or 23:59 p.m. Eastern Standard Time. So everyone is joining in from across the world today, so please align that time to your location. Because the exam will not be reissued after that time, December 16th, 2025 at 11:59 Eastern Standard Time, the answers will be posted and it will not be reissued after that time. There will also be a certificate of participation. It will be awarded to participants who have had the opportunity to attend 7 out of 10 live Zoom sessions, or have a combination of viewing the recordings and passed the final exam with a score of 70% or higher. Asynchronous views after December 16th at 11:59 will not count toward the certificate. So we have a good solid 2 weeks to get all of those views in. In addition, we are happy to be offering nursing continuing education or CE credits for US-based participants and all others that applies for. There is one CE available per webinar, and the person in order to receive the CE, you will need to have attended at least the live webinar session or view the recordings and at least receive an 80% on the post-session evaluation. And you do not need to complete the CE process in order to receive a certificate of participation. These are all of the dates that the password codes have been sent from the Global Consortium on Climate, Health, and Education email address. If you viewed the live session for at least 45 minutes or more. So these are all of the dates that all of the codes have been sent. Please also check your spam folders. Today's session, as I said, is a special session. It is 60 minutes, just like all the rest. But today is going to be a panel discussion. And at the end, we will still have the Q&A. So please put your questions in throughout the course of our chat, and we will try to get to as many of them as possible at the end. The questions should be entered into the Q&A and not into the chat, please. See? And now it's my pleasure to introduce all of our presenters. There are 4 of them today. So we will start here with our first speaker, Kara Cook, who is a nurse and a master's prepared nurse. She is director of the Alliance of Nurses for Health and Environments. Her work focuses on elevating environmental health as a national priority by engaging nursing organizations and individual nurses in environmental health advocacy, education, and practice change. Kara has experience in critical care, public health nursing, and she recently had the opportunity to attend the Conference of Parties conference in Brazil. Next, I am happy to introduce Dr. Elizabeth Turcio. Dr. Turcio is a professor of medicine and executive director of climate health at Cooper Medical School of Rowan University, where she also serves as an associate program director for the internal medicine residency and chair of physician engagement. A board certified internist with training from the Robert Wood Johnson Medical School, the Hospital of the University of Pennsylvania, and a diploma in climate medicine. She leads faculty development, research in hospital medicine, and the integration of climate health across medical education. She has co-developed 24 humanities electives and holds leadership roles in climate and health, the APHA's Center for Climate, Health, and Equity, and the Climate Health Society. Lisa is a researcher, author, and speaker. Her regional and national work focus on climate and health in education, sustainable healthcare, health policy, and equity. The third speaker for today is Haley Blackburn, Doctor of Pharmacy. Haley is a Doctor of Pharmacy, Associate Professor at the University of Montana Skaggs School of Pharmacy, and Director of Education and Outreach for the L.S. Skaggs Institute for Health and Innovation. She leads interprofessional training and advances pharmacists' roles in addressing health disparities, climate and health, and sustainable healthcare. Her work includes research on climate-resilient health systems, the impacts of wildfire smoke and extreme heat, and reducing the environmental footprint of pharmaceuticals. Dr. Blackburn is co-founder of the RX for Climate, serves on state and national climate health leadership groups, and was recently named Distinguished Scholar Fellow by the National Academies of Practice. Our fourth speaker is Annie Rosenthal. Annie is a social worker and Associate Director of Programs and Operations at the University of California Center for Climate, Health, and Equity. Annie is a social worker focused on the intersection of climate change, community resilience, and health equity. In her role at the UC Center for Climate, Health, and Equity, she works on climate health research and initiatives centering people-focused approaches with the goal of strengthening access to care and improving community well-being. So it is my pleasure to welcome all of these speakers today to our sort of like our fireside chat. So it is a very cool day here on the East Coast of the United States. And I sort of want to imagine us all sitting together and sort of instead of veering away from our traditional focus, I sort of wanted to be interprofessional, for us to sort of have a chat and talk about how one of our goals for today's sessions is to seek to understanding a big picture with all different perspectives from medicine, pharmacy, and social work. So I have some questions prepared for all of you, and we're hoping to also welcome this global audience. So this is such a unique moment where, we have all of these interprofessional teams together with experts from each of those. And we also have a global audience of nurses who are hungry for this information and how they can apply it to their region of the world, to their area of expertise. And so we welcome Dr. Blackburn, Dr. Churchio, Dr. Cook, and Annie Rose, Kara Cook, and Annie Rosenthal. We welcome you here today. Um, our next slide is going to say that we do not have any um, uh, vested interest into this. We do not have any disclosures for this presentation. And on our next slide, these are all of our learning objectives. And again, it's to really just talk about how we can bring all of our areas of expertise to a global audience of nurses who has the opportunity in their daily practice to interface with pharmacists and social workers and medicine teams. And so we're going to just off. Thank you for those slides. And we're going to start us off with a question first. And so I think our first question is I'm just going to sort of set the stage for our discussion today. And it really centers on how each of you are seeing the impacts of climate change show up in your area of work or practice. And I'm hoping that each of you can share an example and from your area of expertise. I invite you to share a story or something that really brought this to life with you. And maybe we'll start with our nurse expert, Kara. So Kara, if you can just sort of let us know how you brought this to life in your experience.
Thank you so much, Gina. It's a pleasure to be here with you all. It's really awesome to see the attendance numbers on this call. It's exciting to see all the interest, and I'm so thrilled to be with all my esteemed panelists. I talk a lot to nurses, so I'm really excited to have an interdisciplinary panel discussion today. So I don't work clinically anymore in the hospital. I transitioned out to doing more public health, environmental health focused nursing. And so really the major issues that I've been seeing specifically in the area where I live in the East Coast of the United States, right outside of Washington, D.C. And so extreme heat and flooding have been major concerns that we're seeing in my community. Each summer, the summer season extending, and it's getting hotter and hotter, which is a big concern for, our vulnerable populations, our children, the elderly, those who don't have access to air conditioning. And especially in the area where I live, we have high rates of childhood asthma. And so extreme heat and associated pollution is a major concern for those kids. I also live right down the street from a community that since the 10 years that I lived where I lived has experienced two major catastrophic floods that were in both instances where it had I think it was one or two deaths related, and they're going through this whole adaptation plan to rebuild that area so it doesn't experience that type of flooding because businesses were destroyed in some areas. Again, people were injured. A couple people died. First responders died. So it's a reality that is facing everyone. And I think another big thing that I'm seeing is this, with this transition to using more of AI, we're seeing these pop up of data centers, and there's a couple that are popping up in the state that I'm living in. And these are all, I think, if not all, but most powered by fossil fuels, which is we know is the primary driver of climate change and is not building out more fossil fuel powered facilities is not going to get us where we need to go. So this is really an issue that is near and dear to me. And then I think when I think of nursing, I think of how nurses are real innovators. They're witnessing the impacts of these issues on a daily basis, and they're thinking of solutions. They're figuring out how can we both mitigate and adapt. And so I'll cut it short here, but I'll mention it later when we have other questions about how some of the nurses that I've worked with in the US and globally are really coming up with these really innovative solutions, partnering with communities who are most impacted by climate change and really being at the forefront of
Thank you, Kara, for bringing those perspectives from the East Coast. And now we can move on to Lisa, who can share a little bit about a medicine perspective on how you're seeing the impacts of climate change show up in your area of work or expertise.
Thank you. I'm also in the Northeast, so Kara and I both have these rainy, kind of dreary days outside of our window right now. I am in South Jersey. I'm in Camden, New Jersey, which is a suburb of Philadelphia, and it's a very similar type of community. It's an environmental justice community, so we face a lot of the same urban heat islands and air pollution. But I'm thinking about a year ago, or maybe a little bit more. We had a case of Lyme disease in the winter, which that's supposed to be when people are out, in their gardens and out in their backyards. It shouldn't be happening in the dead of winter. But I'm a hospital-based physician, so one of the projects that we tried to do to really help to target a sick hospitalized population was a study looking at communication and how we can try to bring climate health issues to our hospitalized population. So we actually just published this study where we just asked three short questions, and then we asked our inpatients if they would be interested in downloading a free government app, one on heat and one on air quality, and if they would use it. And remarkably, about 85% of the patients said that they saw climate and the environment impacting their health, which was way higher than we've seen in other studies. And I don't know if this is because, they were vulnerable, they were in the hospital, like they were seeing these impacts more readily, but 85% recognized the issues. Only about 50% said that they would use an app, which, is still 50%. But then I'm just thinking about all of the other opportunities for interdisciplinary teams to really intervene then and help to educate our patients. So it's certainly a lot of other things I could talk about, but I'll pass it on.
Yes, I think you bring something to light here, Lisa. When you say, once you see it, you see it, and raising our level of awareness and raising, within our patients and also within ourselves as nurses, physicians, social workers, pharmacists, just raising that level of awareness and bringing it to life in real time. Yes, and so now we can move over to hear our pharmacist perspective from Dr. Blackburn. So yes, Haley, can you share what some of how you see the impacts of climate change show up in your area of work and practice?
Yeah, thanks, Gina. And hello from Montana. So I'm in the western half of the United States looking out at some snow out my window right now. So the pharmacy profession, I think, we're kind of right in the middle of things. Often when we talk about environmental sustainability, pharmaceuticals are certainly a big contributor to our healthcare carbon footprint in high income countries. It's somewhere between 20 to 30% of the overall healthcare carbon footprint. So I think that points to a major role for pharmacists to play upstream in the sustainability world, for sure, being a part of those teams in environmental stewardship and decarbonization efforts and everything. But I think the other thing that I advocate for pharmacists and where I've seen it show up a lot in my work, and for me personally, is on the side of climate resilience. Um, my personal story is, we're in the western half of the United States where wildfires are now not an if, but a when, and how bad are they going to be? And so we're used to wildfire smoke, we're used to hot summer days, we're used to all of those things, but they've of course been becoming more frequent, more severe. And one of the things I saw this actually very early on in my hometown, where a wildfire came, threatened the structures in the hometown, but also left people there sitting in horrible wildfire smoke. And it's a rural area in Montana, which is a real challenge just for healthcare access more generally in our state and across our region. Um, and one of the things with that is that we think about pharmacists as being this really key healthcare access point and key public health messengers in these communities that maybe don't even have a clinic. They have a pharmacist there. So that was kind of a lightning rod or a catalyst for me to start working with and exploring opportunities for pharmacists to be regular educators in the summers on wildfire smoke, on extreme heat, talking about vector-borne illness, those sorts of things for patients, just thinking, hey, maybe they're seeing them more frequently as they're coming in. They might not see their primary care, but once a year, but they're seeing the pharmacist on a monthly basis coming in. So there might be better opportunity for access to get that education discussed with patients. But I also worked with a local climate nonprofit to start distributing air filters out through pharmacies to get those out into the community during those wildfire smoke events as well. So using them also as like a distribution point. So I think just there's a lot of opportunity that I've discovered for pharmacists to be involved out there in the community, as well as all of the different places that pharmacists are embedded in healthcare teams, right, in hospitals and clinics and everything. So lending that medication expertise, whether it's helping troubleshoot medication stability during heat waves or thinking about heat-related risks, all of those things, I think, we have a lot to offer, and there is a lot of movement just generally in the pharmacy profession to start thinking more and contributing more to this conversation and these efforts.
Yeah, thank you for that. As you were talking about pharmacists being trusted members in our community, I think of my own community here on the East Coast, but I also think of I have family in Italy, and I remember visiting their small village, and there wasn't a hospital, there was maybe a restaurant or two, but there was a pharmacy, and there was a pharmacist there. And I remember people, going to the pharmacist and asking them questions, when they weren't feeling well, and what do you recommend? And so yes, absolutely, they are trusted, and we are grateful. And now we have an opportunity to hear another perspective from social work. So Annie, if you can share how the impacts of climate change show up in your area of work or practice. And I know you wanted us to share screens, so we'll have some slides here. So we'll get those up, and I'll let you begin.
Great. Hi everyone. It's really great to be here. So I live in sunny Southern California. So it's beautiful most of the year, but we have been experiencing a lot of really severe wildfire smoke in our area. I'm a social worker, and social workers hold a lot of different roles and work in many different environments, similar to nurses. So we talk about social work in three different buckets. So there's macro social work, meso social work, and micro social work. So macro is really working at sort of the institutional level, working on policy change and research and that kind of thing. Meso is working with groups and communities and working on community-based programs. And micro social work is sort of that one-on-one individual therapy and case management. So in all three of these buckets, policy, community-based, and individual, are really seeing and attempting to respond to the impacts of climate change. So yeah, you can go to the next slide. So like I said, I live in Southern California, and in this part of the world, the main way we've seen climate change pop up is wildfires. And we've been navigating years of really, really horrific fires. So actually, 7 of the 10 most destructive wildfires in our state's history have occurred in the last 10 years alone, which is mind-boggling. So 2 of those fires occurred just this past January in Los Angeles. So we had, for these fires, 16,000 structures burned or destroyed. So this includes things like health clinics, schools, homes. We had over 200,000 people displaced in this fire, and at least 29 people lost their lives. So we have a lot of people who are experiencing a lot of trauma related to wildfires, right? They're navigating grief and loss and anxiety, post-traumatic stress disorder, and they're also navigating everything that comes from being displaced, right? So I live about 2 hours away from where these fires erupted. So we have a lot of people here in my community who have lost their homes in these Los Angeles wildfires and are really struggling with the mental health impacts of displacement. And we know that this is really prevalent for children as they navigate, new schools and new environments. So therapy at the micro level can be a really extremely helpful way to help. So therapists in the area are reporting that patients are coming in more frequently with climate trauma. And even if they haven't lived through one of these horrific wildfires, a lot of people are experiencing fear and anxiety and sadness about the state of the environment and the future. And again, I think this is especially challenging for young people as they're thinking about what the world is going to look like when they're older. So we have a lot of therapists who are specializing in things like climate grief. And then I'll just touch briefly on at the meso level. We know that these issues are kind of permeating into groups and communities, which is where social workers can intervene at this meso or organizational level. So one example, I have a picture here. These are students who are participating in what's called an ecotherapy program, and this is at Cal State at Chico, which is in Northern California, and was the site of a really bad wildfire that happened in 2018. So an ecotherapy program, and this is run by a social worker, uses interventions like forest therapy to help people who have been impacted by trauma related to the wildfire. And they process grief with one another, and they really work on rebuilding their sense of place and reconnecting to the natural environment. So really, at every level, social workers are seeing the impacts of climate change and attempting to respond.
Yeah, I mean, I think you really bring up a great point about, it's not always something that we have available to us. And so when a social worker is is there, it adds so much to this team, and it brings so much to those situations where you can have the capacity to speak directly to the needs of people that experienced a wildfire or experienced a disaster. And last week, during our session, we had an emergency preparedness session, session 9, and we talked a lot about that. But having the social work team and social worker there really adds so much to this team and to the benefit of our patients and families, and also to us as team members. And you speak a lot to the mental health. In our first course, we had a whole session on the mental health impacts, and it certainly brings so much to this team. So you know, for those perspectives. We're going to shift a little bit and actually somewhat in that theme and talking about how we can partner with our communities. And so I would like to hear from you all again with another question. And what are some practical ways that healthcare professionals can engage community partners to build trust and co-create sustainable and climate resilient solutions? And what's a just if you can share one thing from your experience that teams could do to start doing something differently, and tomorrow, right now, in our areas of practice, and strengthen those partnerships. And we'll start off with you, Kara, again.
Yeah, yeah, thank you so much. So I want to give an example of it's just to provide that practical solution. So the Alliance of Nurses for Healthy Environments, we host an environmental health nurse fellowship program. We're actually going to be launching our fourth cohort in January. But essentially, what the fellowship program is, we select nurse fellows to participate in a year-long program. They're paired with a nurse mentor who helps kind of guide their journey, and they're tasked with partnering with a community-based organization to work on a specific environmental health, well, climate-related or climate-adjacent health concern that the community or community-based partner has identified. And then the nurse, in collaboration with that partner, develops a project or works on an initiative, an existing initiative of the organization. And I think there's re a couple really important pieces of this is that it's the nurse is looking to community for the expertise and the guidance. Nurses are bringing their unique qualities, of course, and their expertise from their kind of position and where they stand. But it's really kind of training nurses in how do you actually use the expertise of the community to help solve the problem, because that's where the solutions are within the community. And the crux of this is that nurse community partners. So how can nurses engage with communities, but how can they also bring their unique contributions to support community-driven solutions? And so a couple examples that we've had that have been really impactful. We had a nurse who partnered with a organization in an urban city in the United States that was working on extreme heat in an area that hasn't typically had to deal with extreme heat. And so become a major concern over the past few years because residents just they don't know how to deal with it. And so they were partnering with the organization to help do education around extreme heat and help promote these climate resilience hubs that the community-based organization was hosting to really help people get in and accessing those facilities during extreme heat days. And so I use this example a lot because I think it's a great example of how the nurse brings their expertise to, providing that education, but also recognizes what the need is in the community and working with the partner to develop the solution. And I think I speak just to nurses because that's who I work with a lot, but I think this is an example that can be across health professions. And we certainly need in these, bigger projects and initiatives, we need more than just nurses. We need other health professionals partnering with communities and working on these big issues. And so I think that's a way in which we can partner. I also think one of the things that we've been working on with the fellowship too is thinking about how we can utilize the positions of power that nurses are in, whether that's within an academic institution or a healthcare facility, and help kind of leverage some of those resources to get resources to the community. So how can we be implementing things within community benefits agreements within healthcare facilities or, healthcare sustainability initiatives? How are those actually working for communities? And so I think that's a really big area that we could see a lot of traction if we really build these interdisciplinary partnerships.
It's such an amazing opportunity to have that fellowship and we can put some information about that on our website and maybe into the chat and on WhatsApp so that people can learn more about that and when to apply and how to apply and when that's available. Okay, thank you. All right, now we'll go Lisa, who is also going to share a bit about something that I'm really interested in my own practice. I'm a pediatric nurse practitioner, and so I'll let Lisa take this away.
Thank you. And I love this question because so much of the time we talk about advocacy and health policy, these things that are very high level and honestly have a pretty long runway. So it's nice to have projects that you can wrap your arms around, something that you can engage others in relatively quickly. And so the Gloves Off campaign, I think, is just such a perfect example of this. Through the Medical Society Consortium on Climate and Health, we've really been running with this in our Climate Smart Healthcare Committee. And it was started in the UK and Australia. I don't know if you can go back one slide, that there's an infographic. I had started, maybe go back another one. Actually, go back a couple more if you can. That's okay. I think we might have missed it. Sorry, you can go back to there. Oh, there it is. Okay. So through the consortium, I was actually working with an ICU pharmacist in Banner Health in Arizona, which is in the southwest corner of the U.S. And so this was represented with permission, but she really took this as her pet project. And she was seeing people, in the grocery store with gloves on, and transporters and people who were bringing food trays with gloves on. And it was just like, why? And so when you start to look into the information about this, as people wear gloves, they're not doing adequate hand hygiene. And because, they have this false sense of protection, but the patients aren't protected. And so they started doing, yes, Yvonne is is incredible. They started doing this messaging and education, and similar programs have really been launched across the world. We can go to the next slide. So from the UK, they have this wonderful ICU environmental sustainability recipe book, which is very approachable because they lay it out just like a recipe. So they have the ingredients, and then they have what you need to do to make things happen, but it's very practical. So, talking about how we don't need to use gloves when we're giving vaccines. We don't need them for transport or if we're just examining people and when you're not in contact with bodily fluids. So, some very simple examples. And I think from an interdisciplinary standpoint, it's so important that this is modeled from nurses, from transport, from physicians, really just everyone coming in contact with the patient. Because after COVID, the PPE use just skyrocketed, such that now when we start to educate people on this, a lot of the nursing students who trained through COVID have only been seeing people wearing gloves. And so it's just so practical. If you can go to the next slide. And now we're getting some really great research out of it as well. These are just some of the tools and implementation guides. If you go to the next slide. There's a study that came out from Australia, which was just wonderful. And if you go to the next slide, it showed that with this interdisciplinary approach, using our infection prevention colleagues, medical and surgical staff, and this educational campaign with reminders and visual displays, if you go to the next slide, they were able to increase their hand hygiene from about 60% up to 83%, and their unnecessary and inappropriate glove use fell to about 23%. So these really big gains, and these were patient-centered gains as well, aside from cost reduction and improvement to the environment. If you go to the next slide. Oh, that was all I had on that one. But yeah, so I think, the more we can find these transposable, really actionable type of campaigns, it helps to get everyone involved and engaged in patient care.
Yeah, I love that. And I love just raising awareness to this. As I said, I'm a pediatric nurse practitioner, and I work in a primary care setting. And one of the biggest things we do every single day is immunizations. And, I was noticing that the nurses were wearing gloves when they were giving immunizations to the children. And, I started to think about this campaign and think about, is that really needed? Do we really need to, in this case, be using gloves? And so I appreciate that discussion about, when it's appropriate. And it really just, um, not forces us, but really encourages us to be thinking about critically what we're doing in our everyday practice. And is that necessary? And do we need to do it just because we always did it that way? Or is that really just something that is necessary? And so I would love to hear, Dr. Blackburn, Haley's perspective on this from a pharmacist.
Yeah, I mean, I think that like just generally the idea of listening and the willingness, I guess, like as we define interprofessional teams or whatever, remembering that that sphere expands beyond not just like our immediate sphere of the nurse and the social worker and the physician that I work with, but also the patients and the community. And so like being willing to step outside of our comfort zone, listen, build the foundations of trust, whether it is in the hospital or within your network or with your partner organization or whatever. I think that's kind of how we lay that foundation. And then there's the idea of like the trust cycle of trust begets trust, right? So if we just start listening and being responsive to whether it's that patient narrative. I think Lisa gave a nice example of, at the outset of patients saying, I'm concerned, I do see these climate impacts. And now you say, well, hey, here's an app, or like, let's respond to this, and let's, we're not ignoring these problems. You're coming to us with your trust. We are responding accordingly. And you can kind of get into that positive cycle. So I think that this is like a very generic way that I'm responding to this, but like, for instance, I'll give one of my specific examples is kind of working with, I got involved with our public health department, and that led to me being on our climate working group and developing trust with the community members, both health professionals, climate experts, city planners, the whole work. So really that very expanded definition of an interprofessional team, and listening to each other around that. And that led to, me being able to contribute some of the pharmacy expertise to some of the ideas around planning and, climate and health and everything, but them also coming to me and saying, hey, could we use pharmacies as a way to distribute some of our community member surveys to start developing some of our climate action planning, our climate resilience planning? Let's gather some data about wildfire smoke and heat and what people are doing for these events. What a great place. Pharmacies, people are sitting there for 10, 15 minutes. You're already a trusted, you're not some stranger coming up on the streets. And so there can be some cool, maybe kind of non-traditional partnerships or solutions that can come out of just those really basic initial conversations, listening to each other, just kind of like fostering that foundation of trust.
We all have a role. And now we'd like to hear from Annie with her social work perspective on how to engage community partners to build trust.
Yeah. I think that, I mean, I agree with what Haley said so much, and I really resonated with it. I think so much of this starts from just engaging in conversations with community members. And, I work for a research center right now. And it's a good reminder that it doesn't always have to be sort of like formal qualitative research that you're doing to find out what people think. It could just be a simple conversation that you're asking people, like, what are the climate impacts that you're seeing? What's most important? What are your priorities? What are the things that are feeling like they're barriers or roadblocks? And using this to really inform interventions. And then these interventions will be so much more effective and helpful if they're really, really informed by community opinions. So this is essential. And I think one example of what these conversations have led to for us is we're helping to support resilience hubs, the development of resilience hubs. So for those of you who don't know, resilience hubs are sort of trusted community spaces like libraries or schools or community centers that can sort of act as a coordinating resource distribution center during a climate emergency, before, during, and after a climate emergency, actually. But it's important that these resource centers and resource hubs are mapped so that they can be available when an emergency happens. So now we're working with the community to figure out like what are those trusted spaces and how can we activate their resources during an emergency? And these came out of just simple conversations with the community. And I also just wanted to say that I don't know if this has been discussed in this class already, but there was a study in the United States about what are the most trusted professions. So for the public, whose opinion do they trust the most? And nurses were the number one profession that people trust. So it really goes a long way to have nurses specifically reaching out to community.
Yeah, I mean, it's community, and that just led so well to my next question that I had for all of you. And, nurses and midwives and other frontline professionals are often the closest to our communities. And how can each of us step into these leadership roles in interprofessional climate initiatives, even without any formal command to do so? What have you seen in your area of expertise and as an example of leadership from the ground up that really sort of inspired some change? And so, Kara, we'll start with you.
Yeah, I mean, I think it can be start with if have some connections within your practice setting that you're in. I know a lot of healthcare facilities or academic institutions have sustainability departments or have some kind of program in which they're partnering with community-based organizations. And so figuring out who the point person is in that organization can be really helpful, but that doesn't have to be the only way. I know, there isn't, unfortunately, even though health professionals are really well equipped to be addressing climate and health, there's not a lot of paid positions for that. So a lot of nurses that I'm working with are kind of doing it on their volunteer personal time. And so that's another way, whether it's just getting involved in the local community where you live or the community that you practice in. Um, it's really, I think where I found the most success is getting involved with the local organizations in your area. It can start as like a local environmental organization, and they're typically partnering with a number of different folks, or it can just be a community-based organization and just, coming, saying you're interested in joining and just be willing to listen and not bring your own agenda, I think is the biggest thing. You want to come in and say, I'm here to help. What do you all need? What are your priorities? And maybe that might be doing something that you aren't quite interested in at first. But that's what the community needs. And that's how you kind of build that trust and show that you're there for the long haul. You don't just want to come and partner. You want to actually contribute and really integrate into the community. And I think that that's the ways that I found nurses and other health professionals be most successful in becoming more involved in climate and health community-based work.
Yeah, I think just to tag along to that, also our professional organizations often help to lead us down those paths of getting information out to the members of those professional organizations. I remember when I was a pediatric nurse practitioner student, I remember my mentor, saying how important it was to be involved in your professional organizations. And in this space, the Alliance of Nurses for Healthy Environments, our partners in Canada, Canadian, Kane, and our partners throughout this entire course, those are great ways for us to stay connected to these issues. There's also, I will mention just a couple things in the chat here that nurses should run for local political positions. Just having a presence on there, having a voice on there is so important, and not just nurses, pharmacists, social workers, medicine, physicians, it's so important. The volunteer work, someone else also said that volunteer work on climate issues can be very rewarding, and it is very rewarding. And someone is also saying that they volunteer with their local organization fighting highway expansions and speak publicly as a nurse about the health impacts of air pollution and how this affects community health. And all these are just wonderful examples of how we can do something within our own scope. If we each did something, that number just magnifies itself. And so I would love to hear from Lisa on how she can, add some perspective to this.
Yeah, and I was thinking when you were talking about when you were a student, I work with a lot of students in our medical school, but nursing students have such an opportunity. A lot of times students think that they have to have a title after their name or have a leadership position to be able to do this work. And I think the Planetary Health Report Card is such an excellent example of how people can just come into the work almost immediately. And they need to have a faculty mentor, but it would be a wonderful opportunity to get more nursing schools involved. Right now, if you go to the next slide, I think there's a picture of what the Planetary Health Report Card looks like. So there's a curriculum aspect, research, the sustainability of the actual university, community-based work, but the students actually lead a lot of this assessment. And only 10 universities so far, 10 nursing schools have completed this. So there's a lot of opportunity to expand this work and to get more people involved. And it's so instructive because everyone wants to get a good grade. That's one thing about healthcare professionals. We all want to get good grades. So a little bit of healthy peer competition can sometimes spur innovation in a school.
Yeah, just the opportunity for the students to have a role in looking at this type of thing is so unique, and it really helps, I think, the faculty to sort of take note of the voice of the students, and the student voice is so important, and so. Thank you for that. And now maybe Haley has something to add in our last final 10 minutes.
Yeah, absolutely. I mean, I think obviously you don't need to be a big L leader to lead. I think you just need the proximity to the problem and the willingness to kind of speak up and make the first move. And that also doesn't mean, I think sometimes people hesitate to take on a leadership role because then it's like, well, then I have to carry this on my shoulders all alone to completion, and I can't do that. And I think that that's the other thing is like speaking up and working toward a more of like a distributed leadership model can be really powerful too, of like how do we empower people to step in, contribute where they can, and lend their expertise to this, but not feel like there needs to be one big leader doing this all. Although, certainly that's helpful to have a paid climate and health position or something to be able to shoulder some of that. I love Lisa's example of empowering students. I think that that's something that can be so powerful. There's a full, next generation of health professions students who really care about this. In my experience, like I teach an interprofessional course on climate and health. We, do a lot of systems thinking where we talk about, okay, let's understand our place in this system and really using that as a way to empower them to say, hey, here's your key piece, here's your key leverage point in this. You can understand all of these different perspectives, and here's like the expertise that you're bringing to the table. And here's a pathway for you to go forward, and you can be a leader. And maybe that's a big L leader, maybe that's a little L leader, but get out there and go for it. And I think like anecdotally, I find that that's really empowering, and that other people around are waiting for just that little spark, and they're willing to jump on board too. So, I guess the call to action here would be don't be afraid if you don't feel like you're quite ready to be a big L leader, be a little L leader by just doing that first step of speaking up.
And if you lead it, they will come. And that is true. All right. And so Annie, can you add to that? Great.
Yeah, and I'll just add quickly because I think all of these points have been excellent. I think that it's an important reminder to really own your expertise. I mean, you might not be the person with the biggest leadership position in the room, but you might be the person who has the best knowledge of what the community needs, or the person who's thinking about equity the most, or the person who's thinking about social justice the most. So really, really bring that knowledge and expertise, and that can be incredibly helpful. And I just want to add another call for professional working groups can be a great way to really harness the power of your colleagues. And maybe it seems like a lot of work to be the person who's like, we're going to develop a whole climate action plan for my clinic tomorrow, but get together with other nurses who are also concerned about climate change, or whatever the issue is, and think about what are the issues that are most important. And that can be a way that you can really harness the power and maybe get further. And we are putting together a professional working group for social workers with the Global Consortium, which we're really excited about. So that's just a little plug. If any of you have social work colleagues that are interested in climate change, send them our way.
Thank you for that, Annie. Yes, everyone has a role, and I was also looking at Haley. We have the pharmacy working group as well, and we have the nurses working group through the Global Consortium, and you know all of us are working together to provide resources globally that nurses can utilize, can implement into their area of practice so that we don't have to reinvent the wheel, so that we don't have to start from scratch. And we're inviting the world, the global community to join with us and to create these resources. And one of the things that we have done through the Global Consortium is create the climate resources for health education, which supports medical professionals and students in getting access to resources that they need um, on all the organ systems and beyond that, and the nurses climate resources for health education. We invite students, back to the students again. We're inviting students to help us to create these resources and to have students be able to help to assist in the creation of these resources. They have an opportunity to publish their work. And who would have thought as a student, I certainly wouldn't have when I was a student, that I would be able to publish something as a student. And it's such an opportunity to get involved, and we welcome you and invite you to do that. And we'll have all those links at the end of this presentation. And I have someone in the chat saying that from Buenos Aires, Argentina, saying many small people in small places doing small things can change the world. And I love that. That's such a great little to end on. And we just have in our just last 5 minutes or so, boy, this hour has gone by so quickly. And there's just we're just going to transition to some of the questions from the participants on this call today. And one of those questions is there any work being done to help organizations create sustainability positions for nurses in hospital and clinical areas? So I don't know if anyone has any input on that question.
I can just chime in real quickly. Our organization, we support nurses who are interested in doing that type of work. It's more so in connecting you with other nurses who have maybe, started sustainability departments or positions or programs within their institutions. I think a lot of it has been figuring out where the gaps are in your institution, connecting with folks who are doing similar work, and then really pitching these ideas to hospital leadership. Because it's unfortunately, because the health systems are so strapped, it's not their first, thinking that, oh, we need to work on climate change. You have to kind of really sell it to them of why this is important from a health standpoint, but also from a financial standpoint for the institution.
I also just wanted to add quickly that GCCHE has a new leadership and sustainability course with Cecilia Sorensen and Cassie Thiel, and it sounds excellent. So for people who want to hone that ability, I think it would be a great opportunity.
Thank you for that. Thank you for those comments. All right, let's see. I think we have time for one more question, and this one goes to Lisa. Back to the glove study. It says, I think it takes assessment in some cases on whether or to wear gloves or not. And as you rethink it, are there protocols in place? Are there generalized or specific in regard to certain departments? Maybe you have some feedback on that.
Yes. So anyway, this is one of the examples where at my institution, I worked hand in hand, no pun intended, with my infection prevention specialists, and they were wonderful. They were so excited about this because it's one of those examples where it's a win-win. It's good for the patients, it's good for the physicians, the providers, the nurses, and it's good for the health system. They're spending less money, they're wasting less. And the protocols don't have to be excessively complicated. If you're dealing with something that's drenched in bodily fluids, well, yes, you need to wear gloves. If you're dealing with cytotoxics or monoclonal antibodies, yes, you have to wear gloves. But for a lot of those interactions, we want the patients to have that provider patient touch. It brings back the connection that we need to have with our patients.
Yes, and good communication. I think so many good points were brought out in this session today. I wish we had another hour. It's been really fun. to have this discussion with all of you. Thank you all so, so much for not only joining us today, but for joining us for all of our previous 9 sessions in this course. There is still an opportunity for you to be able to miss any of the sessions that you might not have had an opportunity to view live. They are available on our learning platform through the Alliance of Nurses for Healthy Environments, and the QR code is here for our resources to join the Global Nurses Working Group, to participate in our first course, that red QR code right in the center. If you would like to participate or utilize any of our learning objectives or other nursing on the climate resources for health education, our codes on the bottom left-hand side of the screen, the pink and the green ones. You can view all of those. Our current course is now over, but there's the final exam, so that will be posted later today. And then also we invite the global audience to participate in our Lancet survey for nursing education. This survey is translated into 12 different languages, which is really fabulous. We invite the global audience of nurses to participate in this survey. We would love to know what you are doing in your corner of the world, in your region of the world, with regard to climate and health education. This will really be helpful in gathering that information, and we invite you. This survey will be open through the beginning part of next year, so please link on to that survey. And thank you so much to our presenters today for this terrific presentation. Thank you so much. Immense gratitude for sharing your expertise in each of your areas that you specialize in. This brings us to the completion of our series, Nursing on the Front Lines of the Climate Crisis, Strategies for Advocacy and Action. It has been an absolute pleasure to join with you all over the past 10 sessions and 10 weeks. Learning from our colleagues throughout the world and fellow nurses joining us also throughout the world. We hope you have been able to take away many new ideas to share with your students and colleagues, patients, friends, and family members, government leaders, administrators, institutions, and beyond. If you missed any of the live sessions, please join us on our learning platform again. And don't forget, the exam closes on December 16th at 11:59 p.m. Eastern Standard Time, so adjust that to your region. Thank you for joining us today from your region of the world. Strategies for Advocacy and Action. It has joined us together for the past 10 weeks. And take care, everyone. Adios, au revoir, arrivederci, mahalo, ciao, ciao. Take care, everyone. See you next time. Bye-bye.
Gracias.
De nada.